Thank you very much for the kind introduction, and I'm really happy to be here and give you a short overview of the National Reference Center for Post-Virus Syndromes in Austria. So I'm co-heading this National Reference Center together with my colleague, Dr. Eva Untersmeyer-Elsenhuber. This is very important to say. We're an interdisciplinary team, and I'm more like public health scientist and general practitioner, and Eva Untersmeyer-Elsenhuber, she's an immunologist. So we really bring together interdisciplinarity in the leading team already. So I'm missing the pointer. Okay. Perfect. So the National Reference Center in Austria, it was an EU-wide tender, and it was really highly competitive, and we won in September last year the reference center and immediately started with our actions. However, we couldn't really create the topics by ourselves. There was already a list made by our Ministry of Health in Austria. We had to follow in the reference center. So we're kind of knowledge hub. We have to bring together the knowledge nationally and internationally regarding post-virus syndromes for our physicians and health professionals. And it's really only about post-viral syndromes. That was also a precondition of the Ministry of Health. We are supporting exchange. We are responsible for training and further education of physicians and health professionals. So also all the therapists. And we're working together with patient organizations. Unfortunately, the reference center is no treatment center for affected patients. Because like everywhere else, also in Austria, there is an extreme need for treatment centers for patients with post-virus syndromes and ME/CFS. And everybody looked forward to the reference center and hoped that we also could treat patients, but that's not possible also because that wasn't on the list of the Ministry of Health at this point of time. However, we really try to be multiplicators. We try to multiplicate the knowledge and really give it to the physicians and therapists, health professionals, that they are able to better treat the patients. So how does the reference center look like? So there are the two centers within the Medical University of Vienna, the Center for Pathophysiology, Infectiology and Immunology, and the Center for Public Health, and with my department, the Department of Primary Care Medicine. And we have strong collaborations and cooperations within and between our centers, of course. We're only 4 patients who are really in charge of the reference center in Austria. So Eva Untersmeyer-Elsenhuber and myself as co-heads. And then we have one key co-worker. This is Angelika Wagner and our administrative co-worker Inga Gambel-Pasteka, who has to organize the many continuous medical educations and symposia we're organizing recently. And of course, we cannot do the center with only 4 persons. So we need strong cooperations also within Austria regarding teaching and research and clinical exchange with the different specialties. So we have cooperations, for example, with medical specialties, health professions. Very important, we have cooperations with patient organizations for post-viral diseases and ME/CFS. Social insurances are very important also in Austria. Rehabilitation, laboratory medicine, virology, internal medicine, pediatrics, and neurology. In red, the treatment centers. So there are still no treatment centers in the public sector in Austria, but hopefully they will be established. And we're really trying to lobby for that and to give the stakeholders all the information and recommendations they need. But we do not have a political mandate, so we do not have political power. We only can advise, we only can counsel, we only can give recommendations. And we only can give recommendations to politicians, stakeholders, and also physicians and therapists who come to us and ask. So of course, we also write recommendations for the public. But we cannot, these are only recommendations that are not like, you have to do this because the National Reference Center says it should be like this. And then fortunately, we also have some international networks. So like, for example, maybe you know, the Dach Consensus Statement for ME/CFS. So this is a very important group of people which we really also then approach and ask if they support us when it comes to continuous medical education, symposia, lectures, etc. And so this is what we're doing right now. So we're kind of central knowledge hub. We really try to directly improve the knowledge of healthcare professionals in Austria. We indirectly try to improve also research, which is a little bit more tricky because the persons have to approach us and ask if we can counsel or support them when they create studies. And we indirectly try to improve also medical care via involvement and creation of guidelines and recommendations in particular for diagnostic and therapeutic interventions. And of course, the support for the establishment of the treatment center. We actually also have a web page. We have a telephone service where you can contact the National Reference Center. This is how the interim webpage looks like. So at the moment, it's based on the webpage of the Medical University of Vienna. But in autumn, we will have an own webpage with own services, also with a password structured sub-webpage for just connecting with the physicians and therapists, and that they can talk to each other in this webpage. So, and just for the end, to give you some highlights. So this is just some pictures from a symposium, or we are also very much involved in media work. So we give a lot of interviews to the media. We try to really explain to them the nature of ME/CFS, of post-viral syndromes. We're there. So this is Doc 1. It's from the Austrian main broadcast television. So it's a documentary about ME/CFS where we were involved. Then we have a lot of activities regarding education. Also for the Gutachter, it's called in German. So the people who really judge if you're able to be on sick leave, for example. But again, always voluntary. So this is what we can do. Then we were very much involved in the National Action Plan on Post-Acute Infection Syndromes, which also is a very important part in Austria at the moment. The National Action Plan on Post-Acute Infection Syndromes, this is with our former Minister of Health, Herr Rauch. So there are also from the Ministry of Health now that we have to do certain actions for post-acute infection syndromes, and we as National Reference Center are very much involved in them and try to push them forward, because it's really difficult, you know, from the talking of politicians to the implementations then for reality. Yeah, so these are just all the all our activities, and this is really the recommendation for the treatment centers, which we did with the Dach consensus statement. And this is, maybe you heard about it also in the German media, there is an indication list for medications based on the Dach consensus statement, which are now covered by the social health insurance companies in Austria. This is also what we really pushed forward, and these are the resources for everyone who would like to know a little bit more about this topic. So thank you very much for your attention.
Okay, thank you so much. And then we can have questions from the audience first. Raise your hand clearly. To those following online, we're trying to help with the problems with our picture.
You know, thank you for the overview. I was just wondering, since you mentioned post-viral syndromes, actually 1/3 of the ME/CFS patients don't report an infection. How can you cope that in this reference center?
Yeah, so this is what the Ministry of Health in Austria wants us to be, the Center for Post-Viral Diseases. So it's obvious that at the moment a lot of patients do not know if their symptoms are connected to a previous infection. So the physician needs to ask, to explore if there was an infection before. This is really tricky. We are trying, so this is a kind of own accent that we're trying to bring into this national center, that we always include ME/CFS as part of post-acute infection syndromes, but also as an own kind of disease that it is. When it is caused, for example, by operation, by surgery, because there are also some things. And so we include ME/CFS in this National Reference Center, and therefore it's a little bit more easy also to write recommendations for the patients that do not can remember that they had an infection, but they have the symptoms, they have the criteria for ME/CFS. So this is how we try to solve this.
Carmen?
Kathryn, thanks for giving us this overview, and I think it's an important concept for Austria. One of the most important things you achieved, I think, is this off-label list. And there are, of course, many questions from German patients, because we have been working in Germany for more than a year on such an off-label list. Could you briefly try to explain why it was more easy in Austria to get this going?
Yeah, in brief, Austria is a small country, and sometimes when you connect the right persons, then something really big is possible. Yeah. Also sometimes for good. Sometimes
it's no good answer for us, because it looks as if we didn't talk with the right persons.
No. But yeah, the momentum was the Dach consensus statement, in particular in Austria. We published this Dach consensus statement, and there was really this one big social health insurance company who really was impressed by this. And there was this box 1 with the recommendation of medications. And so this social health insurance company decided to be really future-looking and implement this as an indication list. Because, and that was really great, they thought, okay, if these medications that are on the list are not that expensive. And so in the long term, they can save a lot of money if the patients have early treatment. And so this was the case. And then other social health insurance companies followed because it was the biggest one. So that was really big luck.
Okay, we have to move on.
Yeah.
And then thank you so much.
Thank you very much.
Great work.